What is somebody to do? Because people are tuning into this from all around the world. How do they go about finding a dentist they can trust in their area? What are some different things they need to look out for?
That is probably the most important thing we can talk about today is finding the right provider. And that goes for anything. You know, finding the right person to cut your hair. I mean, it doesn't matter. That really is so important. Safety, going down the right path in terms of triage and treatment. A lot of there is a real cookie cutter approach out there. It's happening in the U.S. It's private equity is on the rise. It's growing even faster. I just read something this morning on that. It's growing even faster now at a bigger rate. I mean, these are private equity firms that own the emergency rooms in the U.S. They own dental offices, and it's all about managing cost, and that's it. Nothing else. I'm not against managing cost, but just managing cost and not allowing a practitioner to nuance and to really make sure they're treating the patient correctly with the right methods and techniques and surgeries and all that. That is very, very important. So how do you find in that kind of environment, how do you find someone? Well, this is an issue that my daughter and I kind of addressed a while ago. We created this problem. We educated a whole bunch of people when we started our website 10 years ago, Ask the Dentist, and we realized that we had educated everyone, and then the back talk was like, okay, love what you're saying. I get it. It makes sense, but I can't find anyone that will answer my questions and address things the way you are. And so we created a directory of functional dentists. So that's one resource. So if you're just looking for a good dentist, and of course it's not perfect, we do have some in Toronto area. I know that, and they're all over the world. It's a list of it's growing, maybe 250. But anyway, look at our directory on our website. That's a good place to start. If your child, or if you're having sleep disorder breathing issues, or if you think you have sleep apnea, go to the aadsm.org website. That's where I learned all of my sleep dental medicine, and that they have a growing number there of accredited dentists that can get you up to speed a lot quicker than physicians can. They work with physicians. I'm not saying they wouldn't work with a physician, but in terms of getting diagnosed and getting treated, the path is a lot clearer and quicker, and that's important, ironically. But dentists can see it a lot earlier. And then there's asking friends and loved ones at work, and again, don't ask someone who has perfect dental health, because they're really just giving you a referral for the hygienist, and that's important. I mean, I love the office. It's great. How often do you see the dentist? Have you ever had any procedures done? No. Well, you're getting a referral for the hygienist, and that's important. But find someone that's had a lot of dental work done, and specifically in the area that you're looking at. You may have gum disease. Find someone that you know that has had gum surgery. That's a good place to start. That's a kind of a just research, orientated kind of way of dealing with it. And then interviewing the dentist. If they don't agree to an interview, they're probably not someone you want to deal with from a personality standpoint. Find out what their philosophy is. Go to our website. There are other websites too on functional dentistry. Find out what you need to know. Don't go in blind. Don't trust any professional. Make sure you're well educated. There's a lot of information on the web now. And most of it's good, but find an influencer that you trust that is a clinician. I would stick with the ones that actually, are reading the science, reading the studies, but also have some clinical experience, and then learn from them. And then sometimes you can reach out to them directly and get information. I get that on Instagram a lot. I can't give dental advice, but the little bits of wisdom and little tidbits, it's like it'll be a small paragraph or a sentence, and then all of a sudden they know what to do. It's just steering them in the right direction. So again, no real great reply to your question, like this is how you do it. I would stay away from Yelp. I would stay away from Google reviews and all that, because again, like Amazon reviews, do so at your own risk. There's a lot of games being played in that you can pay for reviews. They get family members to review them, whatever. I mean, I'm just, I don't even bother wasting time with that. But do your own research. But I think the best advice I can give, other than those two directories, would be take matters in your own hands, become educated. You're going to have to be pretty well informed, not on all the particulars, but big picture stuff. And in dentistry, you definitely want to be on the side of functional dentistry. Google it, look at it, and it'll make more sense to you than anything else you've ever been exposed to in dentistry. It's the long-term, big picture, global systemic view of treatment, and that the mouth is not just one aspect of the body, and that a dentist is just working in that small vacuum, and then your physician isn't aware of what's going on in that mouth. It doesn't need to be that way. Is that the majority of what's being done today? Yes. But so the answer is you gotta, and it won't take long. It won't take long. Just get the information online, and you'll be able to arm yourself with enough information to be safe. And then last little bit of information. Anything sounds fishy, or if your gut is telling you, seriously, literally, that you're not sure about it, something was off a little bit, get a second opinion. And if your dentist doesn't like the fact that you're getting a second opinion, you've already done the right thing. You've learned a lot about the provider. So, second, I would encourage my patients. Sometimes if it's a big case and it's a lot of complexity to it, I say, and before you sign on the dotted line here, I would get a second and third opinion. See what's out there. And sometimes they do, and that's a good thing, because dentists do have different approaches, and you just have to be comfortable with that approach.
It is an interesting time, though, and a relatively big ask for people when it comes to medicine, dentistry, where you could make the analogy of bringing your car to the mechanic, where you assume they're an expert in that area and they're going to guide you on the best decision for your car at that time. And of course, there's good mechanics and bad ones, and good hairdressers and bad ones. Coming back to your haircut you're going to be getting later this week. But it's unfortunate that the experts aren't necessarily, and likely aren't, tuned into the nuance of what we're talking about today. And we do need to do our own homework, and to at least a certain level, become an expert in oral health, in medicine, so we can make good decisions in the current world when it comes to taking care of ourselves. So it's a very unique and, again, big-ish ask for people to be able to do this, but it's important. You really need to.
So true.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
We use the word metal, we use the word amalgam, silver fillings. They're all the same. They're half mercury and half silver, and they add other alloys in there. So a lot of people are going to their dental offices. They're saying, take them all out. It's not being done properly, and they just inhale.